am Dr. Sundar, Senior Joint Replacement and Tumor Surgeon, also Director at VS Hospitals. VS Hospitals has been in Chennai for the last 15 years and is known as a center of excellence for tertiary oncology care. We have now started a world-class boutique hospital to cater to international patients. The theatre complex here is state-of-the-art with all features which are present anywhere in the world being here. As you can see, the entire theatre complex is Bioclad along with the ICU.
Pediatric hemato-oncologist and marrow transplant physician. Transplant முடிஞ்சிருக்க child, he's now 5 months post-transplant. So he had a disease called leukocyte adhesion deficiency. So it is a primary immunodeficiency disorder. So இவங்களால usually first birthday cross பண்றது ரொம்ப difficult இருக்கும். They will die because of one or the other infections in the first year of life. So in the disease or transplant is one of the most complicated bone marrow transplants. So around 10 children LAD transplant போறாங்கன்னா maybe 5 of them will survive, 5 of them will not survive in a bone marrow transplant. So in this scenario we are very worried about infections because their primary disease itself is prone for infections. So in the case we had help of having a Bioclad. So Bioclad is antimicrobial wall claddings. In the scenario, usually we use tiles in the place of Bioclad. So cleaning a tile, there is an advantage of having a uniformity in the wall surface. Plus antimicrobial cladding makes a big difference to a transplant patient, especially a transplant which is going to be a complicated bone marrow transplant.
I'm Dr. Sasidhar, I'm a pediatric intensivist. I was one of the doctors taking care of doing his stem cell transplantation. Stem cell transplant is a very intensive treatment, especially for a child like us. When we treat acutely ill children, the most important thing is preventing infections. So the environment plays a huge role. The environmental control means the hygiene of environment also equally important. So it can be a tiled wall or it can be a cladding used by some other material. So Bioclad seems to be superior by preventing the environmental contamination and infections because of any cause, especially the fungal related infections.
So in the scenario bone marrow transplant where he stayed in the hospital for 3 months. And in the 3 months, it is very notable that he did not have any bloodstream infections during this period. He had infections because of his disease, and there was no infections which can be attributed because of a hospital environment. So the Bioclad has made a big difference for the transplant outcome in this child. So it is better to prevent the infection rather than to treat the infection. So these modern facilities including Bioclads have made a big difference in current treatment outcomes.